Quadricep function. The next exercise is an exercise that I came up with, and it's called the church pew. Church pew we covered in the course. We explained the rationale. For those of you that have not seen this exercise before, I'm going to give you a little rationale on why I put this exercise in the program. Patients that undergo total knee replacement, prior to the surgery, there is some research out there that shows that they have a 20% quadricep deficit. After about a month, that quadricep deficit can double. After 1 year, that deficit can still be 20 to 25%, sometimes higher. They have functional deficits of stair climbing, time up and go, getting up out of a chair, for example. They also would like to walk a lot faster when you've asked patients. 2 to 3, 4 years down the road, that patient strength actually declines. There's evidence of that. So how can we address this deficit of the quadricep? Traditional quadricep exercises are all voluntary muscle contractions. And if you think about what happens in a voluntary muscle contraction such as quad set, straight leg raises, short arc quads, the brain is telling the muscle to function. The brain is telling the muscle to fire. When you start to get to more advanced exercises such as squats, lunges, step-ups, terminal knee extensions, isokinetics, whatever it may be, all of those again are active voluntary muscle contractions. But the quadricep doesn't function in a voluntary manner. It functions involuntary. You don't tell your quadricep to function. You go from initial contact to mid-stance. So how can we get that neuromuscular adaptation? That's the key. How do we address that neural inhibition that goes on and to turn that muscle on to translate it into more function as well as to meet the needs of the patient? So here's the exercise from the side. Take a standard chair. Make sure that your calf muscles, the example here is for a right knee. The right knee was replaced. I'm post-acute. I'm 6 weeks post. I'm having trouble with initial contact to mid-stance, controlling that terminal extension. So I'm going to put both of my calves to the back of this. And I'm going to sway. It's going to be a controlled sway. Hands behind the back, and I'm going to control sway. I'm going to go from my big toes to my heels. Just control sway. Automatically, I'm getting quadricep to facilitate the contraction just purely in an involuntary manner to prevent me from falling backwards. This is how the quadricep functions when you initially contact and go to mid-stance. It's going to fire without you even putting any cognitive thought. So, we're going to sway back and forth for 2 minutes, back and forth. After 2 minutes, take this little part of the exercise, put it into the whole motion, and assess the patient's gait. Remember, test them, treat them, test them again. To advance the exercise, put the right calf against the back of the chair, the left foot forward. You can raise arms overhead and change the center of gravity. You can do a little bit of some diagonal reaches. And reaches in a little bit of an angle, coming back and forth. 2 minutes, and you're going to feel that quadricep kicking in. The next video clip, we're going to show an example of an 83-year-old total knee replacement patient. I will let you know that he has significant leg length discrepancy, and you're going to see that when he walks. But I really want you to watch before and after the church pew exercise, how that translates. I have not yet found an exercise that can get the job done as well as this exercise.